Okay, let's continue our discussion about the characteristic of your acid-fast stain. Okay, first, again, okay, we have your letter A. Acid-fast, again, is a type of a differential staining procedure. Okay, there are two types of your differential staining procedure. We already discussed about your gram staining. The other one is your acid-fast. Acid-fast is a differential staining procedure that is commonly used, okay, commonly used to stain, your mycobacterium and your nocardia organisms. Okay. Other characteristic that you should know about the acid fast also includes your letter I. Okay, what is the characteristic? Letter I, it divides. Okay, divides bacteria into two major groups. Divides your bacteria into two major groups. Again, what are the two groups of your bacteria? Okay, it includes your acid-fast organism. Okay, your acid-fast organisms, and the non-acid-fast organism. What is the characteristic of your acid-fast organism? Okay, this acid-fast organism, they retain the primary dye, okay, which retain your primary dye throughout the staining procedure. Throughout the staining procedure. Throughout the staining procedure. And since they retain the primary dye all throughout the staining procedure, and thus acid-fast organism stain, okay, what color? Stain red. Okay, that is the characteristic of your acid-fast organism. How about, sir, the other major group bacteria? Your non-acid-fast organism. Non-acid-fast organisms. Okay, this type of an acid-fast organism, they are decolorized and then counter stain and stain blue, which are decolorized and then counter stained so it is stained what color? Blue. Okay, your acid-fast organism, they retain the primary dye all throughout the procedure. Okay, it's stained red. Your non-acid-fast organism stain blue. Okay, stain blue color. Okay, other characteristic aside from your letter I. Okay, next is your letter D. We are following your mnemonic na acid-fast. Okay, next, letter D. What about your letter D? Remember that your acid-fast, they are difficult, okay? They are difficult to what? Difficult to stain. Okay? What is the reason? Because the bacterial cell wall, of acid-fast organism, contains what? Contains what material? Contains a substantial amount of lipid material. Substantial amount of lipid. Okay, that is the reason. Okay, one of the characteristic of your acid fast, they are difficult to stain. Okay, what is the reason? They contain a substantial amount of lipid material. Another factor, okay? Another factor, bakit sila mahirap i-stain? Another factor it appears to resist the penetration of the primary dye to the underlying cellular cytoplasm. Okay, that is another factor kung bakit sila mahirap stain. It appears to resist the penetration of the primary dye to the underlying cellular cytoplasm. Tataas lang natin ha. Their cellular cytoplasm. That could be a factor. Another factor, because they are difficult to stain, letter A, okay, also very resistant. Okay, also very resistant to what? To drying. What would be the effect if your acid-fast, they are resistant to your drying? Since they are resistant to drying, they may remain viable and infectious in a room environment for as long as 6 weeks. Can you imagine? Okay, 6 weeks following contamination by a patient having a disease like your tuberculosis. And again, this characteristic appears to be related to the wax-like lipid composition of the cell wall associated with acid-fast bacilli. Okay, bacteria rather. Okay, because they contain a substantial amount of your lipid. They are difficult to stain. They appear to resist the penetration of the primary dye to the cytoplasm and very resistant to drying. That is the reason, okay, why staining, okay, takes too long sa proseso ng acid fast. Okay, staining time is very long. Staining time is long. Okay, tataas natin ha. Staining time is long. Okay, remember your acid fasts. Mnemonic natin, acid fast para madali. 2 most important acid fast pathogenic organism, nasabi ko na yan kanina. Okay, the two most important. Okay, the 2 most important acid pathogenic. Okay, 2 most important pathogenic organism. Ano nga ulit yon? The causative agent of human tuberculosis? Yes, very good. That is your Mycobacterium tuberculosis. Mycobacterium tuberculosis. Okay, tuberculosis. And the other one, your Hansen's disease or your leprosy. Okay, yeah. Okay, your Mycobacterium leprae. That is the causative agent of what? Your leprosy or your Hansen's disease. Your acid-fast staining of your sputum from patients suspected to have tuberculosis, they are what? They are routinely carried out, and the presence of acid-fast bacteria is diagnostic. Okay, remember that acid-fast staining of sputum from patients suspected to have tuberculosis, they are routinely done or carried out, and the presence of acid-fast bacteria is of course a diagnostic test. Okay, what are the types of your acid-fast staining methods? Okay, types of your acid-fast. Okay, what are the types of your acid-fast staining method? Okay, staining method. Okay, the 2 most common, of course, type of your staining, tataas lang natin.